All right, Chuck, it is time for Doctor on Call. Every month we bring a doctor in here to talk about some of the topics we think are most important and most imminent during this time of the year. We have Dr. Frank Hahn from OSF. And you see folks in both the younger edge of the spectrum and higher into the adult range for heart conditions. Let's talk about hereditary conditions. If your family has a history that you're not aware of, what's the key test you should get to make sure your heart is healthy?
I would recommend to the person to describe their history as best they can to their physician, and then we can help you take it from there to see what kind of test might be necessary.
These days, when you talked about some of your younger patients, what are some of the most common problems you find with heart conditions?
Most of them are consultations for high blood pressure, or the pediatrician thinks that the child might be born with a heart condition, and so then we try to figure out what that might be.
And if it is high blood pressure at a young age, how do you go about treating that?
Sometimes you might need medicines, but typically the first thing is to see if there are things to optimize with how they're exercising or how they're eating, and then take it from there.
A lot of people now trying to concentrate on changing some habits from the winter and maybe exercise more. Is there a difference in pursuing heart health for men versus women?
The broad strokes are the same. Adult women are at slightly different risk of different heart conditions than adult men are, but eating well, exercising, and sleeping, same for both.
What about vitamins and supplements? A lot of folks might try to work that into their routine now. Are there any vitamins or supplements you think are best for women or best for men?
Well, the heart doesn't give out extra credit, so to speak, if you already have enough of a certain vitamin. So I would work with your physician to see if there is a specific deficiency or medical condition that can be corrected with vitamins, and then take it from there.
What's the key issue you see right now with patients you think hasn't been talked about enough?
It would be probably awareness of congenital heart issues.
And how would one go about screening for that if they had no symptom or history of?
We typically start with a set of ultrasound pictures of the heart and EKG.
How long does that take if folks are thinking, I really want to do that, but I'm not sure if it's a big time commitment?
The visit itself takes around half an hour, and then the ultrasound part takes around half an hour as well.
So it can be done quickly?
Yep.
What are some of the risky behaviors we should try to avoid or reduce to keep our hearts as healthy as possible?
In general, I would recommend trying to avoid being sedentary, trying to exercise when you can, and trying to not smoke, and alcohol in moderation.
All right, Doctor, what are you finding in terms of interest in the field? Do you find that folks still want to get involved in cardiology now, or are you finding trouble attracting folks? We've had a lot of talk about health care and filling positions. What do you find in cardiology?
As far as in cardiology, you have to train in either a pediatrics training program or internal medicine first, but the interest within those fields for cardiology is still pretty strong.
So you've got a lot of experts and a lot of staffers ready to help people.
That's right, yeah.
That's good to hear. All right, Dr. Frank Hahn with OSF, thank you so much for joining us and being a part of the conversation. Our next Doctor on Call will be in March. We look forward to that. Thank you so much again, and we'll be back after this break.